Yeah, because he wants these extremist, their perspective is just anything should go.
Yeah, except for I don't know why we have to have a
All right, 1 minute. And do the countdown in 5.
And
You guys ready? All right. It is 1:30 on Monday, March 13th. We'll call the Health and Human Services Board to order. We'll begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. So, starting off today's agenda, I will be looking for a motion to approve the minutes from the February Health and Human Services meeting.
I'll make that motion.
All right. We have a motion by Commissioner Holland,
I'll second.
second by Commissioner Catchmark. Any further discussion? Hearing none. All in favor, say aye.
Aye.
Opposed, same sign. Minutes are approved unanimously. Now moving on to the, moving down here to the agenda today. Looking for any additions or corrections to today's agenda?
Mr. Chair, I'll make,
stands.
oh, I'm sorry. Did Jamie have an addition?
I do not.
Oh, I'll make a motion to approve the agenda as printed here.
All right.
I'll second that.
Just the vice versa before. A motion by Commissioner Catchmark, second by Commissioner Holland to approval of today's agenda as presented. Any discussion? Hearing none. All in favor, say aye.
Aye.
Opposed, same sign. All right. Motion, the agenda is approved unanimously. Today's consent agenda. Would anyone like to pull the consent agenda item for discussion?
Mr. Chair, number 4, letter A, the acceptance of the federal structure grant for discussion.
Perfect. I guess it is the only agenda. All right. So I guess we'll go right over there to you, Commissioner Catchmark. You want to discuss?
Yes, thank you, Mr. Chair. So I read it over, I think it was about a 7-page information sheet, and, well, one thing, I was looking at the 10% toward the bottom, the second line, it says grantees approved indirect cost for the grant 10%. Could you interpret that, Jamie, maybe if that's the match that we'd have, or what does that exactly mean on the first page?
The first page, you said, second from the.
That, there's that gray box on the bottom, and it's the second line, references a 10%. Starts out grantees approved indirect cost. That's on the grant project agreement cover sheet.
I believe it's standard language. I don't have any other information now. I certainly can pull some information about what this is referring to. Typically, I'm not aware of a cost to the county for using the funds, approved indirect cost rate. Looks like Sarah and Kate may have some more information.
Yeah, do you want to?
Yep. So the indirect cost is pretty standard language for like the state MDH's grant. So the indirect cost, because we don't have a work plan listed yet, we haven't actually developed the plan yet, which Sarah can go into talking about. So it kind of depends what our indirect costs will be. Usually it's our fiscal staff, like myself, administrating the grant.
Yeah, or other,
Yeah.
you can charge rent
Yeah.
to it based
Yeah.
on the employee time that's attributed to the grant.
So these would be funds we could draw down as administrating the grant to reimburse us for the cost of the grant.
Correct.
Running the grant.
So roughly 35,000 of this could be used for accounting or bookkeeping type.
Rent.
Yeah, right. Yeah.
Okay, all right.
Cell phones, it kind of depends on what the grant, since the work plan isn't created yet, that's part of the problem. So in
When-
the details of the,
Okay, when did we know that we were gonna get this money?
They've been discussing it for quite a while, so I think we've heard about it
Yeah,
probably since this.
well, we knew MDH, we didn't apply for this, just to be clear, the state did. And the way that the federal dollars are written, the state has to submit a portion of that funds, has to be passed through to local public health, 40%. We knew that they had applied for it. We weren't, I didn't, local public health wasn't involved in writing it, counties and cities, but, and I think we knew that they received it maybe about a month ago, and we've been waiting for the grant agreement. So planning, as Kate just mentioned, we don't have a work plan because we didn't have the contract. So now that we know what's allowable expenses and all of those, then developing the work plan, we can actually charge back to the grant, so.
So when do you have to tell them, okay, sounds good, you can send us the money?
So we're asking, that's on the consent agenda today, so these are all federal dollars that we're asking that the board allow us to accept these funds. It doesn't mean we have to use all the funds, but we're asking for acceptance of the funds.
And
Would
we
be our
have-
request today.
I apologize. And board, we have 5 years to spend the funds.
Oh, nice.
So I'm reading under project description, one of the things you can spend it on is increase the size of the public health workforce. Do you know, it talks about employee retention and training skilled people. Do you know if this money can be used to pay payroll of existing staff?
Yes, it can be used to pay payroll for existing staff. For a retention piece, so support and sustain, some examples that MDH gives, expand. It talks about well-being programs. Apologies, I'm looking for all of that. I know there were recruit and hire new staff, which we're fully staffed, so we would like to focus on the retention piece. And I feel like I should knock on some wood about that statement as well. So I apologize, I didn't come prepared. There's like 5 pages of
So while
examples,
Sarah's
but
looking-
yes.
While Sarah's looking, board, she and I took a look at it. We're not anticipating at this point adding additional staff in public health. I mean, that can always change, I suppose, if there's a coming pandemic or something along those lines, but our plan right now is to maintain the existing staff we have. One of the things we did discuss, since we just found, we had been hearing about this, but as Sarah said, we only heard in the last month or so that it was actually going to be coming through to the counties. Would potentially be doing something along the lines we've done in other areas of the county in order to maintain staff, to potentially create a lead position from an existing staff position, if that would provide it. But we would be coming to personnel committee and board and everything else like that if we wanted to pursue an opportunity for staff that would be a promotional opportunity. At this point, we have no designs to increase our public health staff through this funding.
Now, if you had some incentives for retention, let's say, like some places you want to give $1,000 for any COVID challenges or ongoing challenges, would you be able to do things like that? Or in a union setting across the county, would you not be able to do a standalone incentive for retention with this money? Because everybody across the county can't get it.
Right. I don't know. We've never pursued anything like that. I think it would involve lots of conversations with both human resources and likely the AFSCME union as well.
And I would imagine board. Yeah. I found the lines. So on page 7 of the grant, it says under retained public health staff, it says this could include, but is not limited to, strengthening incentives, creating promotional opportunities. So when we talk about possibly paying for staff time, if you were to promote somebody, or transition staff to other hiring mechanisms. So if you had, for instance, contracted staff and wanted to bring them on full-time, or part-time staff and wanted to bring them up in FTE, those would be examples that are provided. In the other grant guidance I have, which I'm happy to share, it could be things like bonuses, as mentioned, student loan repayments, benefits, moving expenses, remote work, telework. Some of the things we already do, obviously, as incentives and retention efforts as well.
Okay.
I will say that the grant is pretty open to a lot of different opportunities.
very broad.
I find it really great that there's some opportunities for training that we can use and hopefully utilize to be able to get some of our needs within public health met with getting some of the training.
And we have actually identified, I would say, some needs in public health and across human services for leadership training and things like that that we could do for our staff. So good opportunities, I believe.
I'm interested to see what the work plan comes with. I'm hoping that there's a way that we can help and strengthen our mental health needs in our community and somehow working and getting us more staff qualified from a mental health perspective to meet some of those needs, because I know that's always been a challenging from getting our social worker 3 positions and finding them and maybe.
And mental health is one of the priorities that's in our public health plan as well.
Yeah, it might be helpful excuse me, at a future meeting, Commissioner Vetch, or Chair, pardon me, to share some of the other funding that we're looking at. So we have COVID recovery dollars as well, which is significantly more money than this. That staff have been looking at both a staffing component, so supporting across Health and Human Services, supporting folks through COVID and all the things that, like the mental health component that kids out of school, people losing their supports, all the stress of everything with the mandates and stay-at-home orders and all of that stuff. People are still recovering from that. So we're doing a community recovery, but also the staff absorbed a lot, right? Helping more acute clients. The level of work that a lot of people had was just different. And Kim's, even we're still encountering, like we know with the emergency orders ending, we're going to have a lot of changes still happening. So we have several $100,000 in that pot of money as well that we're using on looking at community and staff recovery.
Well, then it makes that work plan even more robust then.
Yeah, we're trying to layer it all together. That's for sure.
Mr. Chair.
Let's not duplicate the efforts.
Mr. Chair, thank you. Is this going to be basically four installments of equal amount of money over the next 4 years, or do you know how that's going to be given to us?
It's based on our expenses, so it's cost-based reimbursement.
Oh,
So we bill it as we go.
okay.
So if it takes us a while to come up with a work plan, or we have minimal expenses, and then we figure something out in 3 or 4, after discussions or something, that's fine.
Did you have a time frame when you'd have guidelines or a plan or anything?
We are, yes, actually, thank you for giving me the opportunity to share what's in my head. Mr. Chair, Commissioner Ketchmark, we are looking at, we have a retreat tentatively planned for May, and we did a very large, along with every other local health department in the state, something called a cost and capacity survey. So we'll be looking at our gaps and then working with staff, and we have some other staff surveys, including our employee engagement survey. So all of that data and spending some time with staff looking at how we might accomplish that with the different pots of money that we have and the timeframes that they're coming in. So sometime after May, we'll start with that employee retreat.
Okay.
All right, is there any other questions or discussion? Otherwise, I'll entertain a motion.
I'll make that motion.
All right, we have a motion by Commissioner Dietrich,
Second.
second by Commissioner Shane. Any further discussion? Hearing none, all in favor say aye.
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 Opposed, same sign. The grant is accepted. All right.
Thank you.
Regular agenda.
And our staff, thank you as well.
Staff announcements. We have a couple new hires here.
We do. So I would invite Stephanie Olson to stand on board. This is Stephanie. She is a social worker in our child protection unit, our called CP2 team. She started on February 27th. So welcome to Stephanie, and maybe she could answer just a couple questions, like what she was doing prior to joining us and where she lives.
Yes, I come from child protection background, a little bit of hospice, and then right now I live in Mound.
Thank you. She lives in Mound, and she reports to Molly Marty. We also have with us today Brooke Schmidt. She is our new Office Tech 2 in our Assessment Services team. The prior opening was vacated by someone that was moving to our BEST group, our Business Enterprise group. So welcome, Brooke. And same question. She started with us on March 3rd, so last Monday.
Well, we welcome both of you to working for Wright County.
Thank you and welcome, Brooke and Stephanie.
And Jamie, the employee of the month for the month of April. Drum roll, please. Is it going to be a nice statement to read here?
Yes, there is. Surprisingly. Commissioners, fellow coworkers with Health and Human Services, I would like to introduce our April Employee of the Month, Ashley Hibbison. Ashley is an Office Tech 2 in our healthcare/METS team. Ashley joined Wright County in May of 2022, so she's been here for slightly under a year. I'm assuming her probation will be a very high high-performing probationary period. She has taken training responsibilities with the new the new office support hires, assisting in building their training curriculum. Ashley has been an excellent model of how to provide internal and external customer services, even in busy and high-stress situations. She has grace under fire personified. Her nominator states, patience. Ashley has been training 2 new employees along with making sure our team is running smoothly. She doesn't hesitate to stop what she is working on to answer questions, explain things in different ways, or share her experiences to ensure we have all the information we need to learn our jobs. Because of her always available training style, we've been able to get comfortable with job tasks in a short time. She stays on task with multiple interruptions and is always willing to help coworkers or clients, providing gold standard service to our customers. So thank you, Ashley, and congratulations on being our HHS April Employee of the Month. I do think it's very telling that she's a new employee herself and is training our new employees as they come in. So that's
Nice.
very commendable. Thank you,
you.
Ashley. Would you like to say anything?
Thank you for allowing me to work here. I'm having a great time.
You're welcome.
Thank you.
Thank you, Ashley.
Thank you.
Thank you. And we're moving right along here to the item number 1 on the timed agenda is the introduction of the new business manager.
So I'll invite Jim Odell to step up to the podium. Not too long ago, I think during my director's comments, I gave you the sad news that Christine Partlow was leaving Wright County for another position. That was in January, and now in March, we are very happy to welcome Jim to our HHS management team. Jim's been with Health and Human Services for about 8 years, working as our technology supervisor. So we are, again, just very excited to have this promotional opportunity for Jim, and we look forward, and I think he's probably already getting a taste of the new job as we are quick and running into our budget season pretty soon. Jim, would you like to say anything?
Sure, yes. I am both excited and delighted to be chosen as the business manager. I look forward very much to overseeing business operations and technology operations for Health and Human Services as we support, strengthen, and serve this community. So thank you very much.
Introduce your 2 new team members that are over here as well.
Sure, yes. We have Dina Peterson is our new business project coordinator on the business technology team, and Heidi Davis is one of our new business technologists. So, yes, and they're learning the streaming system for board meetings.
Thank you.
Thank you.
Jim, I think you're well suited for the position. I think it's great to keep the continuity in the office, especially in light of all the changes that have taken place over the last couple of years. You're well aligned with Kate in the finance department, so I think you'll easily be able to connect the dots to make the changeover seamless.
Very
I think
good.
that's his whole job. His whole job description is connect the dots. So once we get that mastered, we'll be in really good shape. Yeah. So I'm very excited to have Jim on board as well. Thanks,
Thank
Jim.
you.
All right, the second item is the joint co-responder pilot proposal.
And I'm just staying up here long enough to introduce both Matthew Treichler and Jill Pooler. Health and Human Services has met a few times now with the Sheriff's Office, and we have a proposal that we would like to just let the board know about and get any thoughts you have on this. In the meantime, I will let Jill and Matt take over.
Good morning, Mr. Chair, members of the board. So over the past 12 months to 16 months, we've been in conversation with Human Services regarding a co-responder program. And just for background, a co-responder program is essentially law enforcement paired with a social worker, mental health professional that responds to those calls for service, live in real time that have a mental health component. That could be something suicidal. It could be just other mental health, disorderly conduct call that comes in. Historically, law enforcement is really good at triaging incidences, in real time at the scene, but we only have certain tools available to us. So some of those low-level calls or low-level crimes where we don't have a lot of other options in our disposal except for arrest, calls a relative or friend that can come care for this individual, or take them to a hospital for a mental health evaluation. We're seeing an increase in these kind of gray area calls where we have a need for some other mental health professional on scene with us to help kind of triage, offer services both in those particular instances and also follow up after the fact. Those calls that come in when those people aren't working, things that come in on the overnights, and our frequent flyers. Like I have an individual that probably calls me or emails me 2 to 5 times a week with varying grievances that are really mental health related, and there's not a lot of services that we can offer. I take those calls because it is one less call for service that the deputy has to take, and if I can handle it over the phone, and if it's just a little personal service that we can offer, that I can offer, to eliminate that call for the deputy on the road that might take them an hour, where I can handle it for 10 minutes on the phone, that's worth it to me. But it's this team concept that could help bridge that gap and offer continued services to those types of people who otherwise would be frequent flyers for our office.
I think that's a perfect segue into this slide, and this is just basically a bullet-pointed list of many of the things that Matt was already sharing, but bringing that added mental health expertise during the call and being able to follow up with that client on afterwards really is going to be reducing stress, hopefully on that individual during the, after the crisis is over, but also during the time to prevent harm to themselves or others. We're hoping to streamline the continuum of care for individuals to access services, and I think that's a really big part of this program, is that then creates a diversion from jail to a more appropriate mental health-based services. And of course, by utilizing this kind of a collaborative approach, we're hoping to reduce reliance on emergency rooms and other community providers, and as well as repeat calls to law enforcement, making their jobs more efficient so they can be responding to other calls. And hopefully we'll be able to provide some more stability for these individuals so they have less repeat emergency crisis scenarios in the first place, and we can get them the mental health support they need.
Yeah. So initially, what we're looking at doing this summer, kind of a pilot project, phase 1 of pilot project, is when our SRO staff, when school is out for the summer, they're assigned other tasks, either patrol, compliance checks, POR checks, that type of thing. One individual will be assigned to patrol is going to be tasked with the co-responder program. Initially, probably like 2 days a week. There's some logistical things we're trying to work out between personnel and just overall staffing by using the staff that we currently have, just to see whether or not this program is going to have value both for the community and for us. Is it sustainable? Is it something that we see a benefit on the sheriff's office side, on the human services side? If it is, then we'll kind of continue to look for grant funding. We already applied for one grant called a BURN grant. There's another one called a Connect and Protect grant, federal grant with dollars attached that we could use towards this program. But initially for this summer, just to see whether or not, does it even have value that we should explore moving forward?
So as for Wright County, or for social services, we're planning to use one of our level 2 social worker outreach positions, and starting out just a few days a week, like she said, on the initial calls, and also some of that follow-up work. We feel like that pairs well with that particular position, but as you know, that does pull away from their other current duties, so that's not something we're able to sustain long-term. We're going to do that for the summer pilot to kind of get a feel for what the outcomes are for the community and for us to decide that, like, how we want to pursue funding going into the future. And we'd ideally, like Matt was saying, we've already applied for a couple grants, and we'd like to continue doing that in the future. So that's one ask we have of you, is if we could have the board's approval to continue looking at grant funding to be able to support staffing into the future to make this program more sustainable, because right now utilizing our existing staff won't be a long-term plan.
Is there a possibility of going after utilizing some of these public health dollars from the COVID piece as well as the original grant that we had there? I mean, with being such a high mental health touch to it.
I'm not sure about these workforce dollars. However, we were looking at the opioid dollars that they're doing the RFP for pretty, I think the survey was taken in criminal justice. And I want to say chemical prevention was both listed fairly high on the survey as far as how to spend the opioid dollars. So we think that was potentially as one amount of money, but I'm not sure about the workforce grant that we just discussed. Yeah. But potentially the COVID recovery money, we would have to take another look at that.
And we have already worked with our public health department, and they have provided some funding for us for training. So we will be having, now I gotta remember her name, Marie Ridgway and Associates, who is well-versed and has been doing some training throughout the state on co-responder type responses. We already have her scheduled to be coming on May 30th and 31st to be starting to train our staff on how this type of a program would work, what the policies and procedures would look like, how this would actually function in the field. So we're already getting our legs under us by utilizing some of that public health dollars already. So yes, we are definitely looking into that as well. And then the grant that Matt mentioned about the
Connect and Protect.
Connect and Protect is very well suited for this type of program. In fact, it's practically written for a co-responder type program, so we're hoping to be able to write for that grant and be successful.
We did talk with HR regarding the social worker 2 position to see if it could lend itself to this, because instead of having another job description out there, and with one small change, which was to add the BCA background check, we all felt that it was the job prescription lent itself ready to do this type of work.
It would be nice to see this really take off, just because I look at there's so many people, especially from the elderly mental health cases, and a lot of times deputies are going out to homes 4, 5, 6 times, and there hasn't, even after that, there hasn't been any real case developed at Health and Human Services on these individuals, when clearly there is a mental health need here. More often than not, there's a onset of dementia in a lot of these cases, in which case we should be cognizant from a Health and Human Services perspective, because it's not a matter of if, it's a matter of when they're going to need more care than what they currently have.
Correct.
We also feel like it's a good opportunity. Right now, we have a social services staff who is part-time working in the jail, helping with some discharge planning and some reassimilation to the community after people are being released. This is our opportunity to get in front of that from the proactive side.
Mr. Chair.
Yes.
Thanks, folks, for coming in and briefing us on this. I was wondering, it's mentioned here twice that you'd be looking for equipment needs. Can you share what kind of equipment you could foresee being needed that we don't have for this initiative?
For this summer program, really nothing. For a future program, if it's going to be more well-established, a radio, we probably have a dedicated, on like more of a, like how our traffic car is marked, where it's blacked out with exception of on this passenger side door, there's an emblem. That would be a piece of equipment. Computer, a couple of minor things. Overall, with the exception of the squad, there's not a lot of equipment need.
Maybe a radio?
Yep.
All right, thank you.
And one last thing, I will say, initially when we first started having these conversations, I personally was a bit of a skeptic, just traditional old school, hey, law enforcement, we were, like I said, we're really good at triaging. We go there, we handle these things really, really well. But reaching out to some of our neighboring partners, St. Cloud, Stearns County, Sherburne, a couple other a little further out agencies that run this program, and every single one, I thought I'd get the response of, yeah, we run it, but it's okay. Raving reviews, to the point they're all looking to expand, add additional staff. So obviously there's something here initially that I was missing. So on further research, it looks like nationally these programs have been wildly successful. So.
And earlier this year, Diane Erkins, our adult mental health supervisor, and I had the opportunity to go to the Criminal and Mental Health Summit in St. Paul, and it was completely focused on these programs, and all the different programs throughout the state of Minnesota came and presented, and that's really what kind of lit a fire under us to start looking at how can we get in on this and really make a benefit for our communities. So the last slide is just wanting to share that obviously we see this as not only a benefit potentially for the clients that we are serving every day, but it's a bigger, larger benefit to all of the community players in Wright County. So our hope is that if we were able to get this program up and running and have it be sustainable long-term, we would want to get some kind of a mental health stakeholder or task force group, something that would really pull all the players throughout the community together, so we could keep looking for providing direction for the system-wide improvements. How can this program really be beneficial not only to the Sheriff's Office and Health and Human Services and our particular clients, but throughout the whole system? You know, how can we help benefit hospitals and detox and all the other folks that really are going to hopefully see a benefit from this type of service?
Mr. Chair,
Yes.
I noticed that Howard Lake PD is not on the list. Did they opt out of participation, or?
That was just an oversight.
Oversight.
They should be included.
Okay.
All three PDs have issued letters of support for the program, so.
I love the idea of having a task force to it, especially on the onset and the creation of it, for the fact that a lot of these mental health situations, or a lot of these even just people on probation, is the post-release, whether it's from a mental institution, from an emergency room, or from jail or prison, is the follow-up and the lack of resources to follow up on the individuals to make sure that they're getting their needs met so that they're actually making forward progress and not backwards progress.
Mr. Chair.
Agreed.
My question is, you know, what is the response? So I know law enforcement is in 8 to 4:30. What about the like overnight shifts? How do you manage that?
So those would be handled as they are traditionally now, with the exception of an email report sent to the corresponder team. They would follow up after the fact once they're back in service.
Okay.
And of course, we're starting off small, what we can handle with our existing staff and resources and seeing how it goes. And then, of course, the nice thing about being a paired collaboration within our county is that we can move and shift and make changes as our resources allow, and we're able to see what the demand is.
I think there's a great possibility for funding options, like you said, from COVID recovery dollars to potential grant opportunities that you have out there, as well as even we could look at internal ARP funds if we need in the short term to get the project off the ground. So it'd be interesting to track the caseload to see what kind of momentum it's getting going and seeing what you guys think there could be from a future potential with it. So I support entering into this pilot program. I hope my fellow board members do as well.
Yep, that's what I was going to say. I was just going to ask also, yes, thank you for presenting. This sounds great. How big are the teams in these sister counties that they put together these programs already? What does it evolve to and look like?
So currently they're each one law enforcement staff member, one mental health professional. I believe it was Stearns County is looking at adding a second team and a mental health professional in their dispatch center, just to help field calls and do triage over the phone.
Okay. Thank you.
Thank you.
All right. Is there any other questions? Otherwise, I'll entertain a motion to advise the Health and Human Services staff to move forward with the creation of this pilot program.
I'll go ahead and make that motion for the pilot program.
I'll second that.
All right, we have a motion by Commissioner Shane, second by Commissioner Catchmark. Any further discussion? Hearing none. All in favor, say aye.
Aye.
Opposed, same sign. Motion passes unanimously.
Thank you.
Thank you, board.
Thank you.
All right. The Health and Human Services Board, the planning.
Yes, thank you, Chair. We, as you know, and actually from the onset, when we had a couple of new commissioners join, I've had some informal conversations with commissioners about potentially changing up the structure of our HHS board meetings, like the one we're at right now, to do something that would coincide more with our county board meetings. Since then, talked with our Assistant Administrator Clay and with Assistant County Attorney, I think he has a different title, Greg Kreiser. We were looking at statutes and looking at ways that we can enable kind of a more efficient system, I guess, than what we currently have. As much as I enjoy presenting to the board at every opportunity, there might be a better way to handle it going forward. So with that, we looked at the statutes. I talked to some other directors and other counties to see how they handle their HHS board meetings. There is a statutory requirement to hold HHS board meetings. Attorney Kreiser has said that the board operates as a Health and Human Services Board in this meeting. You also operate as the Community Health Board in this meeting. And both those hats would then have to follow you to any other structure we have if we have it during a county board meeting. So what I was going to propose, and I understand that there was discussion at the board retreat, maybe in January or February, on this topic. I believe it was raised at that time as well, with some thoughts about let's look forward on how this could work. So unless you have any questions, what I was going to suggest is to move our HHS board meeting. We've already, in the January meeting, we scheduled them to meet at this time throughout the year, but to move the HHS board meeting from the second Monday of the month to the first Tuesday of the month at 9:45 to coincide with the regularly scheduled county board meetings starting April 4th. I do realize that this will probably change the dynamic of how we present information Some of the presentations we do would potentially move to the board workshop. I think because we have this forum, we probably haven't utilized the board workshop as much as potentially other departments, but that would be one way to do it. We might just need to have more things on the consent agenda or other ways to apprise the board of things happening in HHS to look for board approval as we move forward on initiatives. But I'd be interested to hear whatever you think about this proposal.
So just for detail of how this would look, it would look similar to like ditch items on the county board meeting, I'd assume, Attorney Kreisler, because it would be like we just put on our drainage authority hat and it said at 9:45 we will put on our public health authority or our health and human services board hat. It's not an entirely separate meeting. It's just a meeting within a meeting that you're just switching hats, whether sometimes as the county board, we're switching to the drainage authority. Other times we're switching hats to planning and zoning perspective. So this would just be another hat that we'd be pulling off and putting a different one on at our county board meetings.
Yes, Mr. Chair, members of the board, that's exactly what staff is envisioning is you'd basically be taking off your county board hat, putting on your health and human services hat. And part of the proposal we came up with here is we'd like to have it be a timed scheduled item, so that way we know officially at 9:45 on the first Tuesday of the month, you're officially putting on your HHS hat. Sometimes in ditches, we sometimes start going astray, and someone always has to remind you of at least get it in the record that, hey, we're here on our ditch authority hat at this time. So we just want to try to make it be a delineated agenda item so that it's firmed up and everyone knows what hat we're wearing when the clock strikes 9:45.
Mr. Chair?
Yes.
I think I'll support the idea. One thing I'd ask just for continuity, consistency, is that your agenda deadline matches the rest of the board agenda by.
I'm sure we can make that happen.
And their agenda would have to, because it would be within the county board agenda, so they would be under the same timelines from agenda creation.
There would be efficiencies, I would say. The staff that are, here, Amy's time and my time, there'd be efficiencies in doing it under the board, the umbrella of the county versus separately as an HHS board.
So just from a procedural perspective, is this something that at this board we have to pass a resolution, or is it just more of a procedural direction from the board to say that we are going to move it to a different place and time?
I think what we could do is we can just do a resolution on April 4th.
Okay, so one
just,
more.
Just changing the time.
Oh, at the Tuesday, April 4th.
We'll just do an April 4th
okay.
at that time. Just changing the times.
All right. Because I think we set our time and dates by resolution.
Yeah.
Yeah, so we just need to make a new
For the Data Practice Act, we set our regular scheduled meeting, so we'll just follow up with an amendment.
All right. So just mostly, just want to make that the consensus of the board is such, so that way when we go to April 4th, we can draft up such a resolution changing the date and time of our Health and Human Services meetings.
Yeah.
All right.
Very good. Thank you.
Thank you. And moving on to our fourth item on the agenda is the presentation of the Community Health Improvement Plan.
Board, I'd like to introduce Joel Torkelson, and we also have with us Becky Graham, Greg Weiss, Keith Bennett. I don't know if Mona is here.
No.
And Melissa Pribble. But Joel will be presenting this information.
Sorry. For some reason, my PowerPoint is not pulling up.
We don't have enough winterscapes, so it's really good to see a winterscape on the screen. Yeah.
Makes me just from running
I wish it was
around
the
on
beach.
lake.
Sorry. Good afternoon, Mr. Chair and Commissioners. Thank you for the time today. Simply, we're here to ask for your approval of this 2023 to 2025 Community Health Improvement Plan. We were last going through this in March of 2020 when the pandemic hit, and we did not get this opportunity to present it to the board and ask for approval. That document was essentially very close to a completed product, and it did get our work since 2020. And if you recall, we were back here in January kind of giving you an overview of our community health assessment. This plan here is essentially our next step in the whole process. It's a requirement of local public health. My apologies, I'm a little excited to be here and finally have this plan completed. There's a lot of work has went into this. And it's really important because it guides our work and our community's work over the next 3 years. I want to thank Allina Health, Buffalo Hospital, CentraCare, Monticello, and Wright County Community Action for the years of partnership and support. I consider myself very lucky to be able to work with them on this whole process. Learning more about their organizations and how they serve our communities has helped me to do my job better, and us as a public health department and as Health and Human Services working together. And also our public health staff, in particular Becky, Greg, Keith, Christy, Cecilia, and Sarah. Whether you work directly on the programming, the policy work, or provide the direction and support to carry out action steps day in, day out, your role and vision for how we help our communities is remarkable, and thank you for what you do. This chip identifies 3 priority health issues. That's really part of this, a key to this work is going through all the data and trying to have, through a systematic way, talking with community partners, organizations, and having conversations about what's happening in our communities, figuring out what is really the most important things that need our attention. So we boiled that down to 3 health issues. Completing this plan meets a critical requirement of the Minnesota Department of Health. We are required to submit this at least every 5 years. The work is an ongoing process, as this graphic, I think, explains this work extremely well. It's like once we're getting down with one part of the process, we're on the next, and I'm sure in all of our jobs there's something quite similar, but it's just an ongoing iterative process. We are required to monitor data, strategically allocate resources where they're needed, and continually adapt. If you want to know more specifics about what we plan to do over the next 3 years, a lot of the work that we're doing to address these priority areas, our staff have that information. In this plan, we really want to try to make it digestible as best we can for the community, and with information that's useful to them. So there's some specifics as far as some of the projects, the ins and outs we just didn't include. Our priority areas are misuse of alcohol, tobacco, and other substances, dental health, mental health, and well-being. These are the same priorities that were identified in our previous plan, and again, this is done in conjunction with CentraCare, Allina, and Community Action. I'm not going to go into the specifics of this, but what's in our plan? A really important piece of this is explaining the frameworks of what we hope to achieve within addressing these priority areas. We identify goals. This is the exact same goals that the other partners have identified. It's in our community needs assessment. We go a little further and identify specific objectives. These are related to the processes that we choose to do over the next 3 years or going to do, and also hoping that we can achieve some certain benchmarks as it pertains to health behaviors. We give a little bit of information about our activities and our partners. I think this is another really important piece to highlight and just acknowledge is that in this work, it's not us as public health, it's not just the county, it's a lot of different organizations, a lot of different entities that support this work, that we work together, and we're extremely thankful for that. And without that, we really couldn't have the impact that we hope to do in addressing some really important issues that are facing our community. Some new things we've included this year, or this plan, is some success stories. I think oftentimes it's hard to kind of just take a moment and reflect and think about what's been done, and just even acknowledging that, whether it's even, or we hope that we're achieving what we're setting out to do, and sometimes just things happen, but also it's an opportunity to just acknowledge some good things that are happening, that have happened. We've also included in the document a section about how to use the plan, so if people stumble across this on our website, maybe they might pick something out of this and figure out maybe this is something they could help do in their school or their community, something new that we included. We included limitations and our areas for improvement, just being completely honest with ourselves and the community that there are still some significant issues facing our communities and we can't necessarily do it all. And it's also impacting the health of our community. So I think it's challenging ourselves for the next go around to maybe look even further upstream in addressing some of the issues that are happening. Also identifying some policies needed. In a perfect world, it would be really nice to address some policies, and we do accomplish those things, but on an ongoing basis, it's important for us to identify policies that are impacting the health of our residents and our communities. And we do, in the plan itself, I hope you, if you didn't get a chance to look it over, hopefully you can. And some of this information, especially the success story, staff did a really good job explaining more in depth about what that means. So we have, in recent months, we've created a webpage under public health called Data and Reports. We posted our last assessment. Our hope is to include this improvement plan on there as well. And we're here to ask for your approval of this document. Again, I thank you to Buffalo Hospital, Line of Health, and Centricare Monticello, and Wright County Community Action. My apologies that they weren't able to be here today. And as it's necessary and or you see fit, we're happy to come back and share updates. Typically, we would like to do this at least on an annual basis just to keep you apprised of what's happening. And I'm happy to answer any questions if you do have any.
Board members, is there any questions? Information? This is always a great document and it's a living, breathing document. It's interesting over a period of time how you see it changes and how the priorities shift and the needs shift in the community. So it's in how it just meets those needs, and these improvement plans literally have made big dents in the changes in our community, hence why the document changes all the time. So,
and I think one thing I forgot to mention too is that I think it's an important tool for us too, because it allows us to access grant dollars as a public health agency. That's another unique thing about this, is that if we identify these issues and grant dollars are available, we have the data, we have the plan in place. It's can be very beneficial in that regard as well.
Yep. Thank you, and I applaud public health on a very comprehensive plan. And as they say, what doesn't get planned doesn't get done. So I agree. I think it's a great plan, and we have some good opportunities to move forward in these critical areas.
So, and upon approval too, we would simply post this on our website, so it's on our public webpage, and then we'd also send it to the Minnesota Department of Health to meet that grant or that requirement of local public health.
all right. If there's any discussion, otherwise I'll entertain a motion.
I'll make that motion.
All right, we have a motion by Commissioner Holland,
Second.
second by Commissioner Shane, to adopt this community health improvement plan. If there's any discussion, hearing none, all in favor say aye.
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 Opposed, same sign. Motion passes unanimously.
Thank you.
Thank you.
Director's comments.
I have a single item. Annually, the Child Support Department participates in a statewide self-assessment. This year, Wright County had 4 child support cases pulled. Each of the cases was worked on by a different case manager or a different child support officer. All 4 were found to be correct and in compliance, and this just demonstrates the high competence of our staff in our child support area. For the new commissioners, we collect about $14 million a year in child support for Wright County. They're typically Wright County orders. Just for some clarification, it doesn't mean all the families live in Wright County, but the child support order was set in Wright County, and those are, along with some interstate orders, are the orders that we enforce. So they always do a very good job. They're a high-performing team.
Thank you.
Thank you.
Is there any other business to come before the Health and Human Services Board? If not, we are adjourned here at 2:18.